Good afternoon. Today we start the first full week of the fire break period here in Wales. This weekend has been dominated by the issue of what can and can't be sold in supermarkets. I understand that there's some confusion whenever new rules to control the spread of coronavirus are introduced. I want to clear up some of that confusion today. I was very saddened to see this particular exchange on social media this morning from a supermarket telling a woman she could not buy period products. This is simply wrong. It's an incorrect reading of both the regulations and the guidance. And I'm very sorry that this woman was given this information. Supermarkets are open and trading, as are many other shops, and are able to sell the wide range of everyday items that we all need. But there are some other items that won't be on sale for the next 2 weeks. These are items that other high street shops, which are currently closed, can't sell at the moment. We face a very real public health emergency in Wales. We have a 2-week period in which we need to do everything we can to break the cycle of transmission and do everything that we can together to bring coronavirus under control. Infections occur and are spread when people are in close contact with other people, in homes, in pubs, in shops. We've listened carefully to what people have been saying. So we will take action today so that retailers understand that our rules already allow people in acute need to buy the basics which are essential to them over the next 2 weeks. But we also ask people to understand the very real crisis that we are facing at the moment in Wales, and to please treat people working in our shops with the respect that they deserve. We're meeting retailers this afternoon to review the regulations and guidance to make sure that it is being applied fairly and consistently. If there are anomalies, we will look at whether the guidance need to be revised or strengthened to make it clear that supermarkets have some discretion to sell to people who are in genuine need. Coronavirus is widely circulating in all parts of Wales. Cases have been rising in most local authority areas throughout October. In total, there are now 8 local authority areas where the 7-day incidence rate is higher than 200 cases per 100,000 people. In Blaenau Gwent, Cardiff, Merthyr Tydfil and Rhondda Cynon Taf, the incidence rate is now higher than 300 cases per 100,000 people. This is the now familiar slide that shows just how high and how fast cases are rising in Wales. Yesterday, Public Health Wales recorded a further 1,158 cases of coronavirus. We have now recorded more than 43,000 cases of coronavirus since the start of the pandemic in March. Very sadly, on Saturday, there were a further 5 deaths, making last week one of the deadliest since the peak of the pandemic, with more than 60 people dying as a result of the virus. Public Health Wales will today report a further 6 people who have lost their lives. My thoughts continue to be with all those families who are mourning the loss of a loved one. Sadly, we will see more deaths and more suffering before we are able to bring the virus under control and to see the end of the pandemic. The latest information that I have from our NHS shows that we have passed the milestone of having more than 1,000 coronavirus-related cases in our hospitals in Wales. That's an 18% increase on the number of people in hospital from last Sunday and the highest number since June. This number includes people with confirmed and suspected coronavirus and people who are recovering. The number of confirmed cases has risen to 616. That is the highest since the 24th of May and is up 26% on last Sunday. we are moving very swiftly towards the April peak, the point at which the NHS came very close to being overwhelmed. But in the spring, we had already postponed all planned operations and appointments. If we carry on at this rate, we will reach that same point within a matter of weeks. The number of people being treated in our critical care units with coronavirus has also risen sharply since last week. There are 56 people in critical care with coronavirus. That is up 40%. Overall, we have 172 people in critical care beds across Wales. This is 20 more than the usual number of beds the NHS would have. The NHS has already started to increase critical care capacity and has planned to expand to 292 beds if needed. But this type of expansion comes with real harms. The areas which are transformed tend to be theatres and recovery rooms. Turning them into critical care areas means we need to bring staff in from other parts of the hospital, and our ability to maintain surgery becomes even more squeezed and reduced. That in turn has a direct impact on patient care and people's lives. This is not an easy time for any of us in Wales. For the next 2 weeks, we must all live with a new and very tough set of regulations. These place serious restrictions on our daily lives. The rules are here to protect all of us. They are here to help our NHS, and they're in place to save lives. Over the coming 2 weeks, we are going to be asking extraordinary things from every single person in Wales as we live with the firebreak. But above all, we're asking for your help. This is not something that the government can do alone. It's only with your help that we will be able to break the cycle of transmission and reset the mounting harm that is being caused by the virus. Help our NHS to cope with the pandemic and normal winter pressures. Help to save lives. Thank you very much. I will now take questions from journalists and will broadcast all the answers live on our social media channels. The first question this week comes from Adrian Masters from ITV Wales. Over to you, Adrian.
Thank you, Minister. You referred at the beginning of the press conference to the confusion and some of the criticism that you've received over the weekend for the list of essential and non-essential items. Regardless of the rights and wrongs of the situation, do you accept that the row has knocked trust in the Welsh Government's handling of the regulations and that could cause people to ignore what you're asking them to do?
I'm generally concerned about the messaging over this weekend because it's taken us away from the reason why the firebreak has been introduced. And it is important that people trust in what the government is doing and why, and the message we're getting from our National Health Service about the mounting levels of harm that coronavirus is causing. The weekend's messages have moved us away from the reality of the mounting death toll that we're seeing and the fact that we will see more harm coming over the next 2 weeks. When we published the evidence paper last week that underpinned our choice to introduce a firebreak, we were very clear that we would see more harm coming and you won't see the impact of the firebreak until another few weeks after it ends. That means we can expect to live with greater harm for the next few weeks, the evidence of that in front of us being made real. What this government could not have done is, in the face of that advice, in the face of the evidence of mounting harm, to have chosen to do nothing. And the package of measures we put in place included the closure of non-essential retail as one of the elements that makes up what we're trying to do to save lives. And that's the message we all need to reflect on and remember as we go about our choices, as we go about the next few weeks.
Thank you. And if I could ask you about a different subject, could you confirm that bereavement is a reason for a compassionate exemption to the rules? In other words, could somebody meet up with a family member with or without social distancing in order to provide support during bereavement?
bereavement is a reasonable measure to undertake, to travel, to see other people. But again, we ask people, wherever possible, to respect the rules on social distancing. What I wouldn't want to see is that people gathering to support each other in circumstances where they've lost a loved one potentially end up being a meeting that spreads coronavirus with that much greater harm. And as I said, Adrian, we've just gone through one of the deadliest weeks since we came through the peak of the pandemic. I don't want to see a further loss of life. That's why we've had to change the rules. That's why the fire break is in place. And while people support each other after a bereavement, and like many people watching this, I've gone through family bereavement myself as well, but to make sure that that support we provide each other doesn't lead to further harm being caused. Thank you, Adrian. We've now got Dan Davis from BBC Wales.
Thanks, Minister. You said that people who are in acute need of something should be able to buy it in a supermarket. That sounds like it could open up more confusion, more difficult conversations if people are allowed to go into a shop and ask the staff if they really need something to sell it to them. Instead of relying so heavily on discretion of supermarkets and their staff, isn't the easiest thing to do just to change the rules and say, yes, you can open all your aisles?
Well, with respect, Dan, the answer I've just given Adrian from ITV sets out that we have a package of rules to interrupt the chains of transmission, to interrupt and reduce the harm that the virus is causing. If we simply end the rules we have on non-essential retail, we'll see more mixing. The stay-at-home message will be less effective by giving more people more reasons to leave the house. And if we do that, we simply couldn't change the rules in supermarkets, because the unfairness that would provide for smaller retailers who are already there, and you'll see this picture in Ireland, as I'm sure you know, Dan, where smaller retailers are complaining bitterly about the fact that larger stores are selling items they've been prevented from doing so. If we essentially see that non-essential retailers opened up again, we'll have to revisit the public health advice we've got about the effectiveness of the fire break. And I certainly don't want to be in a position where we have to row back on the choice we've made to have the shortest possible intervention to make the maximum difference. We looked at a package of measures to keep Wales safe. That was the advice we had, that was the advice that we published, and we've acted on that advice. If we want to unravel that now, we'll be in a very different place, a less effective measure, and that's not what this government is going to do. It's about how we make the rules we have effective, clear, consistently applied, and how we all act together to keep Wales safe and to save lives.
And ministers have been saying that another fire break in the new year is possible, that it can't be ruled out. Then yesterday, the Deputy Economy Minister said it was likely. Is he right? Is it likely that we'll have another lockdown in the new year?
None of us can say what's likely. What we are being really upfront with people about is that the fire break is necessary now with the exponential rise in cases, the exponential rise in harm that we're seeing. We want to have a national pattern for all of us to live our lives by to get to the end of the year. We'll need to look at what's happening through that time. We'll need to revise and look at where we are as we get there. I can't give you a guarantee about the position that we'll see at Christmas. So I certainly can't forecast or get into a hypothetical answer about the new year. Measures are possible for the future, but that depends on how successful we are in coming together as a nation to act in a way that means a coronavirus is less likely to spread in the future, less likely to cause the harm we've already seen, not just at the peak, but within this last week, with more than 60 families mourning the loss of a loved one. And that's what we all need to reflect on as we go about our business in the fire break and beyond. Thank you, Dan. I've now got another Dan. It's young Dan Bevan from LBC.
Thank you, Minister. Good afternoon. I want to touch on something that Adrian mentioned, and that's trust. The Welsh people have trusted the Welsh government throughout this, even throughout some of the toughest measures anywhere in the UK. So my question is, why now don't you trust the Welsh people in supermarkets?
We've actually looked at what's happened in the reality of where we are. We've looked at the advice we've had about needing to reduce contacts, needing to close non-essential retail as part of that package. And this isn't about trusting or not trusting. This is about an effective stay-at-home measure to make the fire break effective and to do that in a way that is fair to all retailers. And that's the choice that we've made. And I come back again to the fact that we're seeing mounting levels of harm, not just those people who have lost their lives over the last week, Dan, but as I said earlier, when we talk about critical care beds, we're now about 13% over our normal capacity for critical care. Nearly 1 in 3 beds are occupied by people being treated with coronavirus. This isn't a game, this is something where we need to reflect on the seriousness of the position that we're in and the hardship and the difficulty we're all going to have to live through the next 2 weeks will make a difference in saving lives. And I don't think we can be clearer that that's the point and the purpose that lies behind the rules we have in place, and ask people to understand that and to support the change in rules that we all need to see.
And you talk about people being able to buy non-essential goods if there is a genuine need. I wonder if you could give us some examples of what a genuine need would look like. And frankly, why should it be down to the government to decide why people might need something? There might be some very sensitive issues that are at play. Why should someone have to go to someone who works in a supermarket and ask, and disclose such sensitive material about themselves in order to buy something that has been deemed non-essential?
Well, these are the same categories of what's essential and non-essential we had in the first period with the first peak down, so we haven't introduced new categories. And our challenge is that if we don't have an understanding of what we think is essential, then we'll have all retail open with greater opportunities for mixing, and we'll see harm continue at a different rate. Now, we've got to take into account the really difficult choices, and we're not choosing between a perfect answer and an imperfect answer, having to balance up all of the harms that are being caused as we look to not just prevent further deaths from coronavirus, but also, if we don't arrest the increase in cases, we'll see a rise in harm from non-coronavirus harm as well, because we'll have to close off other parts of our National Health Service. So I don't think it's really a runner to have an effective fire break, but then to open up non-essential retail. That will unpick the whole approach that we're taking. And the point about discretion is we do recognise there have been exceptional circumstances. They've been well advertised and talked about examples of people who really do have a desperate need to buy individual items, and it's about that. And we can either have an approach where we do rely on people's common sense and ability to talk with retailers about what really is an emergency and to make sure that's provided, rather than being deaf to the real concerns and complaints that a very small number of people would go through this next 2 weeks. For the great majority of us, though, of course, we'll be able to manage for the next 2 weeks. But the hardship, the interruption that causes, yes, but to avoid the much greater hardship and the much greater interruption to people's lives and their ability to still see family and friends in the future. Thank you, Darren. I've now got Ivor Bennett from Sky News.
Thank you, Minister. By giving supermarkets discretion over this ban, aren't you just adding to the confusion around the rules? After all, how can a shop decide what is and isn't a customer's acute need? Surely you're risking a repeat of situations like the one we had with Tesco and customers not being able to buy sanitary products this morning.
Well, with respect, they're two entirely different things. Let's not confuse what we're talking about. With Tesco and the banning of sales of sanitary products, they recognised they were wrong, they deleted their tweet, and they apologised. So they're very clear that they got it wrong, and we should just accept that that's what's happened. And I'm glad that Tesco have clarified the position now, and that no one should be spreading misinformation that somehow Welsh Government rules have prevented the sale of sanitary products during the fire break. That simply isn't true. The point about if people really do need to go out and buy in exceptional circumstances, things would otherwise be part of non-essential retail, is that we've got to allow, and our rules already allow, for the provision of some of those exceptional circumstances to arise. So it isn't about whether I want a new toaster, it's about what is the exceptional circumstance where that might be needed and required. So we've already provided for that, and that's always been within our rules in any event. And it's a very different position to say, do you really provide for that exceptional circumstance, or do you simply open up non-essential retail again and undermine the point and the purpose of the fire break to be effective and to help us to save lives?
On the issue of non-essential retail, obviously some of those shops can still trade online, but what about those businesses that can't? How is this fair to them?
Well, as we know, many independent retailers do already have an online offering, and we've heard from lots of those in Wales over the last few days who have gone out and talked about the fact that they are trading successfully online. But the point here is we're reducing opportunities for people to see each other and to have contact with each other. It's part of our very clear and very understandable stay-at-home message. So to go up for things you really need, as opposed to go up for things you want or would like to get. And that's the point, to stay at home, to keep yourself safe, to keep your family, your friends, your community safe, and to help save lives. And I don't think we can be any clearer than that. And you pointed about the imperfection of some of the measures being taken. Well, that's the world that we're in making choices to balance the harms that are taking place and to understand for all of us there is no perfect answer. Every single choice comes with harm. And it's about balancing those harms to make sure that we're keeping as many of us alive, maintaining as much NHS activity as possible. And that's really important to understand. If we don't do this, it won't just be we'll have even more coronavirus cases in our hospital. It will affect the other care that the NHS provides that is essential to keep people well and alive through winter. And that will maximise and increase further the harm already being caused. None of us should forget or lose sight of the fact this is a public health emergency. Lives are being lost. Every day, we're going to be reporting more lives lost. Every week, I'm afraid, for the next few weeks, we're likely to see an increase in the number of lives that have been lost. I think we're doing the right thing in acting with all the difficulty it causes, because I'm confident that because of the choices we have made here in Wales, we will save more lives. Thank you, Ivor. I've now got Adam Hale from the Press Association.
Good afternoon, Health Minister. Are you and your colleagues accepting any responsibility about the problems with messaging and communication about the non-essential items ban, either in how it was delivered or leaving it 24 hours before lockdown to actually announce that stores would be told they had to police people shopping?
Well, to be fair, stores through all of the period of lockdown have known they've got to think about the items they're selling. So stores themselves had to think about this in the first period of lockdown. So that in itself isn't new. And of course we want to learn from how we get to this point to make it effective moving forward. There was a conversation on Thursday that I took part in with Leslie Griffith and major retailers. We've had a further conversation over the weekend within government, listening to what people are saying, and we've arranged a meeting for later this afternoon. And of course, ministers take responsibility for the measures that we're putting in place. This is difficult. It's hard for people. It's hard for people to accept sometimes that the rules need to change and there's a significant intervention into lives. And the government, of course, continue to learn lessons from how we do our job effectively in communicating not just with stakeholders, but with the public, but not losing sight of the fact that this is a public health emergency where lives are being lost or interrupted, where we're seeing 1 in 3 nearly of our critical care beds treating people with coronavirus. This is very, very serious. It's for all of us to do the right thing to keep well safe.
Thank you. And on that earlier point about stores using their own discretion to sell non-essential items to individuals if they feel as though they're necessary, can you actually spell out how people should be going about that? Or are you going to leave that direction ambiguous?
No, there's a conversation we're having with supermarkets and other retailers today about how to make that clear. So a number of people have said that they were upset they couldn't go and explain why something was particularly important for them. And these are going to be limited circumstances, because much of the comment that we've seen over the weekend has actually been on the what-if scenario that is unlikely to happen over the next 2 weeks. And I think we do need to provide for that sort of set of exceptional circumstances and for people to be able to have a conversation discreetly with people in the stores that they're visiting to understand what that need is. And the danger is that if we say that if you don't have a perfect system, you can't do anything at all, we'll again lose sight of why the fire break has been introduced, why this is a package of measures to keep people safe, And this is because we have chosen to act early, to intervene before more harm is caused. And I continue to say that is the right thing for this government to do, for any responsible government to do, not to wait until much greater harm is caused. And I actually think that when we get back to that public health message, most people will be much more understanding about the level of inconvenience we're living in, to avoid the much greater inconvenience, the grief that people will suffer if they too have to mourn the loss of a loved one, as indeed more than 60 families across Wales have done this week. Thank you, Adam. We've now got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. Firstly, when can the Welsh public expect to know what rules they will have to adhere to from November the 9th onwards, when the firebreak lockdown ends?
Well, we're expecting over this week to engage with a range of stakeholders. There are conversations taking place today, tomorrow, Wednesday and Thursday and beyond. And we'll then expect to come together for the Cabinet to agree a set of rules. We want to be in a position to give people at least a week or so to understand what the new rules are that are going to be in place. But it's really important we have that conversation with stakeholders through this week. And then, of course, we need time before the firebreak ends for everyone to understand what the rules are. There's lots of learning about how we've come into the firebreak, to apply that, to understand that. And equally, it means we've got to understand the advice we're being given by scientific advisors and the Chief Medical Officer on what a sustainable set of rules will look like to allow people to go about to living their lives and to be able to see more people in a different context, in a way that coronavirus doesn't take off again, because we've seen more than once that this is a highly infectious new virus. We don't have a cure for it. We don't have a vaccine for it. So what we do to prevent the virus spreading is essential if we're going to avoid the sort of scale of loss of life that we've already seen in the first peak.
Thank you very much indeed. And secondly, you mentioned it briefly in your statement, but what's your message to those going into shops in only their underwear, or those tearing down coverings, preventing people from buying non-essential goods?
Well, I think that sort of irresponsible behaviour won't help any of us. There's real frustration from lots of people. The people doing that need to look again at what they're doing, and people giving them encouragement and a platform to do so with the divisive sort of political messaging we're seeing need to take a step back again. They also need to reflect on the fact about them making lives very difficult for our shop workers. They deserve to be treated with more respect. The next 2 weeks will be difficult for all of us. Much more difficult for every single one of us in the country if we don't act together, and if we do see a much greater loss of life than the one that we may still see, even if we do all pull together. This really is about saving lives, and I'd ask everyone in the room, everyone in Wales, to play their part in making sure that we reduce the number of lives that are lost, and more of us can look forward to a greater sense of freedom in the future when we get past coronavirus and still have as many friends and family to celebrate that new freedom with in the future. Thank you, Mark. I've now got Rupert Evelyn from ITN.
Thank you, Health Minister. Your meeting this afternoon with the supermarkets, given that they took action based on guidance from your officials and believed presumably they were doing what they'd been told to do, what are you going to be telling them to do differently this afternoon?
Well, we've had feedback from supermarkets and a range of other retailers over how the first weekend has gone. And you've seen the well-advertised example of where an individual store and a larger retailer has done something that others haven't done. There's learning from within retailers themselves and between them to make sure that we do have a consistent application of what our rules provide and what the guidance provides as well. That should mean greater clarity, not just for businesses and their workers, but for the public as well. And I do think that greater clarity and consistency will be helpful for all of us in making sure we all understand what we can do. It's important to think about what we can do and think about what we're going to do to act together to reduce the loss of life that we'll otherwise see here in Wales.
And my second question, you've sounded at times during this press conference really quite angry. How do you sum up your feelings towards how the Welsh public have taken your firebreak so far over the last 3 days?
Well, I'm not angry. weighed down with responsibility for the challenges that we see with the lives that are being lost, and the reality that if we don't act together, I'll be coming to press conferences like this to announce the mounting harm we continue to see, not just in our National Health Service, but in communities up and down Wales. This isn't a point for anger, it's a point for reflection for all of us about the great national challenge we face, about the much greater loss of life that we will see if the firebreak isn't effective, if we can't persuade people to follow the rules that are in place, then we face a very difficult, long, hard and unpleasant winter ahead. And that's the risk for all of us. And the prize for all of us is that if we act together, we'll save lives. We'll have a different sort of Christmas, yes, but we'll have a Christmas and a future we can all look forward to in the future with more of our loved ones around us to celebrate that. That's what we're looking to do. That's where we're asking people to behave in a truly extraordinary way. It's the purpose of this government to keep Wales safe, and that's why we've introduced the firebreak. Thank you, Rupert. I've now got Lydia Morris from the Daily Post.
Thank you, Minister. Can you tell me how the Welsh Government came up with the list of essential and non-essential items? Did it work with retailers to compile the list? And would it not be easier to just publish it for everybody to see?
We have used the same categories of essential and non-essential items that we had in the first peak of coronavirus, and we've published those categories. They're in not just the regulations, but they're also in the guidance that we provided. If you want to look at the guidance, it's on page 5 of the guidance. It sets out the categories of areas. What we can't do is go through a line-by-line categorisation of every single retailer, of every single part of their offering. That would be wholly impractical. And the meeting today, I think, will provide the clarity that retailers themselves are looking for, that the public are looking for. And as I say, retailers themselves will have learnt some lessons from different parts of their own operation, and they'll have seen a different way of applying the same rules and the same categories within their own businesses. So it's an important opportunity to learn and to make sure that the next 2 weeks of the firebreak are as successful as possible in this shared national effort to help save lives.
I know the Welsh Government's aim is to be fair to small businesses, but if Tesco is struggling to understand the non-essential rules, how can you expect the public to?
Well, with respect, Tesco made a mistake, and it's a mistake that shouldn't have happened in trying to withdraw and make unavailable sanitary products. That was never the point and purpose of the rules we have in place, and I was generally surprised to see that that had happened. So this is about how we help people to understand and have that clarity. But actually, when you look at the categories of businesses that can continue to operate, the goods that can continue to be sold, I don't think it's that difficult or unclear. Most people are going about their business living within the rules that we've set and understanding the reason why we've had to close a wide range of businesses to help keep us all safe. An interruption now in the way we live our lives, an interruption in the transmission of the virus, and all for the point and the purpose of gaining more control over transmission here in Wales, on saving lives, on saving our NHS to protect it from being overwhelmed. And I'd ask you and all others, all of us living here in Wales together, to think about how we help and support each other to get through a difficult 2 weeks, how we help and support each other to get through a truly extraordinary winter ahead. Thank you, Lydia. We've got Josh Searle from the Argus.
Afternoon. You've touched on it briefly already, but treatment of shop workers was a repeated issue during the national lockdown in the spring. A shop workers union has now felt the need to ask shoppers not to take out their frustration on employees. Is it a worry to see this sort of behaviour rearing its head again?
Well, at this point in the normal cycle, I would probably be having a conversation with local shop workers. I'd almost certainly be doing something together with Usdaw Union, as would many other members of the Centre of the Cross Party, to urge people to treat shop workers with respect in the run-up to the end-of-year festive period. It's a challenge that we've seen grow over time, where more of us, I'm afraid, are less respectful of shop workers and the job that they do. We've seen that exacerbated through the crisis. We've seen a fanning of the flames of anti-lockdown feeling in a way that isn't simply about disagreeing with the rules that are in place, disagreeing with the public health arguments that underpin the firebreak, but do it in such a way that is divisive and actually plays to extremes in behaviour. We're trying to make sure that we support the message that our shop workers deserve to be treated with respect. If you don't agree with the rules, contact your local elected representative. It's a choice that we're making, and we want people to at least buy and understand why we're doing this, even if people don't agree. We've had clear advice from our scientific advisors and from our chief medical officer. This significant intervention in people's lives is necessary to significantly intervene in the transmission of the virus. It is a highly infectious, deadly virus. It has already affected more than 60 families who have lost loved ones over this last week. More of us will be in that position in the coming weeks ahead. The interruption is to reduce the number of people who will suffer that loss of life, who will mourn the loss of a loved one. So respect your shopkeepers as you go about your day-to-day business, and please follow the rules to help keep all of us safe.
We saw a police presence near the Stevens crossings on Friday evening as lockdown began with some vehicle checks taking place. Is this something we should expect to see continue throughout the lockdown period?
Well, it's a very simple stay-at-home message, and so police are going about educating and engaging with people and enforcing the rules if they need to. I've seen a policing report from the weekend that reflects very good levels of compliance. There have been a few incidences where there has been a need to undertake some enforcement. So whilst we're in a stay-at-home period, just as we were in the first period of time in the pandemic, then you can expect the police to enforce the laws of Wales. It's a simple matter of doing what's right. They're doing their part to help keep Wales safe. We all need to do our part as well. Thanks, Josh. We've now got Rob Taylor from Wrexham.com.
You seem quite steadfast in batting issues over the weekend to supermarkets, and perhaps one in particular. On Friday, the First Minister told me the supermarket sector is very mature, very responsible, and will want to do the right thing. If a range of retailers in an apparently competent and willing sector can interpret what you say so incorrectly, surely that points to communication problems your end, not theirs. And why wasn't this dealt with on Friday evening?
Well, we have had conversations with supermarkets, as I say, on the Thursday about the categories of areas. There's been an understanding from the first time around about the categories that exist. And as the First Minister said, there were people at that time who thought that other retailers weren't following the rules in the same way. They've been very clear in indicating to us that they wouldn't simply sit back and see that happen again. Some larger retailers as well as smaller ones, and as I've said, you see the opposite of this in Ireland, where smaller retailers are very upset about the fact that larger stores are selling non-essential items. So it's both about the fairness of what we're doing and looking to work with retailers themselves to make sure there is clarity and understanding, but it also comes back to the point this is part of the package of measures we have in place to reduce contacts as part of our stay-at-home 2-week period that's left in the firebreak to help save lives. And we can't forget that clear public health messaging about the reasons we've had to intervene in the way that we have.
Thank you. And several businesses have been in touch this morning expecting the Economic Resilience Fund Phase 3 to be open. Currently, people progressing through the checklist are told the grant fund will be open for applications from the week commencing the 26th of October. The local authority have also said they're waiting for guidance on the business rates elements of that. When is the ERF3 opening, and why is it not open today?
Well, I can't give you that detail, but I'm sure that Ken Skate's department will be making clear when that is available, because as you're right, that we've intervened significantly, and that's meant a number of businesses have had to close. We've put from the Welsh Government's own budget a near £300 million package of support that the Economy Minister has made available, and we'll be happy to clarify with you and others when those applications will be available, because we do want businesses to survive, to have the opportunity to trade and trade safely, for their workers to be safe in their workplace, for customers to be safe as well. We'll happily clarify when that support is going to be available. Thanks, Rob. We've now got our finish with Tom Magner from Carers World.
Thank you very much indeed, Minister. I'm going to take you off onto another issue, if I may. We've seen a Carers Trust summary that states and I quote, "In England and Scotland, you can also be prioritised for testing as a recognised key worker if you're an unpaid carer." That's the end of the quote. Closer to home, the Hull Thar University Health Board refers in an update on Test and Trace to critical workers or unpaid carers. Although it's fair to say if you try to follow the link, you don't appear to go anywhere. So the question is, are unpaid carers officially recognised as key workers in Wales? If yes, why do you think the confusion's occurred? And if not, why not? And what do you intend to do about it?
Well, the starting one is that we don't think we do have access problems at this point in time with people getting a test, so it shouldn't matter whether you're a critical worker or not. And when we did look at this in the first period, we did then make sure that carers were recognised as in a category around critical workers as well, so they were prioritised above the rest of the general public because of the impact that their role has, not just on them, but on the people that they care for. So if we got to the point where we were restricting tests, then yes, there'd be a different provision for unpaid carers compared to the rest of the public, but we're not in that position. People should still be able to access tests, and we're not restricting the availability of tests to the wider public.
So informally, it is the case, but you'd review it if push comes to shove. Can I just take you to another aspect? One other viewer raises an issue about PPE no longer being exempt from VAT at the end of this month, which is last day Friday. What efforts will you make, are you making, or have you made to persuade Chancellor Rishi Sunak to extend this exemption?
Well, I'm really concerned, having seen that it's apparently the current intention of the UK government not to extend the VAT relief on PPE, and that simply can't be right. As we are in a second wave in every part of the UK, to load 20% of extra costs onto PPE items just cannot be the right thing to do. So, I'm sure that, and we'll decide which minister it is, we'll be in contact with the UK government to make clear we think this is the wrong thing to do, to ask them to reconsider and to consider the impact on our health and care services and on how that money is then used to keep people safe if there really is to be a 20% increase in the cost of a range of PPE items. I hope that the UK government will listen and reflect on that and change course before that VAT waiver is lifted. So hopefully there'll be some cross-party support to make sure we can all encourage the UK Chancellor to do the right thing.
Thank you.
Thank you, Tom. As ever, it's a pleasure to answer questions. I look forward to speaking to you and answering questions again in the very near future. Many thanks.